Millions of seniors are about to receive a massive increase in their Social Security benefits. There is a $1,190 Social Security increase that is getting ready to be shipped in March. Let us see who is eligible. And if you stay till the end of this video, President Trump is getting ready to gut Medicaid. That is going to impact seniors, veterans, and children. And there's a long list of people that have been impacted by this. I've done the research. I have the latest update on what the House of Representatives is doing to gut Medicaid and who is going to be impacted. If you're new here, hit the like button, hit the subscribe button, because all we do is bring you the latest news and update, anything in and out of Congress that's going to affect your Social Security, Medicare, Medicaid, food stamps, and more. Now, before we get started, as always, I want to know where you're watching this broadcast from. So go to the comment section and let me know your city and state. So let's talk about this huge breaking news about Social Security increase. So the Social Security Administration just released an announcement that they are going to send $6,710 in back pay to those who are eligible for the Social Security Fairness Act. So if you've been paying attention to the news, the Social Security Fairness Act was passed a couple of weeks ago. It was signed into law, and there are two parts of it. The first part is the monthly increase. So depending on where you fall in the ladder or in the chain of events, you're either going to get $360 or $1,100. And there's also a second part, which is a lump sum payment of $6,710. So let's get into the details of who is eligible for this massive Social Security increase. So the Social Security Fairness Act was signed into law on January 5th and eliminates two provisions that previously reduced benefits for certain public workers. This change will approximately affect 3.2 million Americans who receive a pension from work not covered by Social Security. So what happened was that there were a certain group of public workers that if they were paying into Social Security and into a public pension, they were either denied Social Security benefits or were given a huge reduction in their Social Security benefits that they've paid into. So the law repeals both windfall elimination provisions, which is called the WEP, and then the government pension offset, which is called the GPO, that reduce benefits for public employees. These provisions had previously reduced or even eliminated Social Security benefit for teachers, firefighters, police officers, and other public workers. So not only is the government making this right, they are also going back retroactively and paying eligible recipients a lump sum of money. So the law is effective retroactively to January 2024, meaning that eligible recipients will receive back pay for the increased benefits they would have received. The retroactive payment are being processed now, with most recipients getting their lump sum payment, which is about $6,700, starting in March 2025. So if you're one of those people that is a beneficiary of this Social Security Fairness Act, you should be seeing a big check or a big deposit in your bank account in addition to the monthly benefits. That is about $1,190 on average. Most eligible beneficiaries don't need to take any action, as the Social Security Administration is automatically identifying and adjusting affected accounts. Recipients will receive notices in the mail explaining their benefit changes, though many may get payments before the notice arrives. So who benefits from this change? Well, the law primarily benefits teachers, firefighters, police officers, and other public sector employees in states where these workers did not pay into Social Security. Not all public employees will benefit, only those who receive a pension from work not covered by Social Security. Now, federal employees covered by the Civil Service Retirement System will see significant benefit increases. These employees were exempted from Social Security taxes due to their federal careers, but then they also pursued private sector careers that made them eligible for Social Security benefits, but they were either denied or their benefits were severely cut when they were eligible. In addition, Surviving spouses, widows, and widowers of public employees who were previously affected by GPO will now receive full survivor benefits. Some surviving spouses who previously received no benefits at all may now be eligible for substantial monthly payments. And then people who work part-time or part of their careers in jobs covered by Social Security and part in non-covered jobs will now receive their full earned Social Security benefits. This includes many who work in private sector jobs before their government sector careers. So how much are you going to get? If you're one of the 3.2 million people who is eligible for this, how much are you likely to get? Well, through March 4th, the Social Security Administration has paid out $7.5 billion to 1.13 million people with an average lump sum payment of $6,710. This represents back payment for increased benefits from January 2024 to present. So, what are the monthly benefit increases? Well, starting in April 2025, eligible recipients will be receiving their new higher monthly payments for their March 2025 benefit. Social Security benefits, as you may know, are paid 1 month behind, so your March payment will be paid in April. The amount of increase varies widely based on the individual circumstances and pension amounts. Some beneficiaries will see relatively small amounts, while others will see about $1,000 increase per month. So, what is the total? How many people are going to actually receive this check? Well, more than 3.2 million Americans will receive the benefit, with the Congressional Budget Office estimating an average monthly increase of $360 for WEP affected beneficiaries by December 2025. And for those affected by GPO, the average increase will be $700. And then for those affected by GPO who are spouses, their benefit is going to be the largest, which is $1,190 for widows and widowers. So what are the dates? When is this money going to hit your bank account? Well, the Social Security Administration began processing adjustment and retroactive payments the week of February the 24th. So this just started. The processing is largely automated, but some complex cases will take longer to resolve. Most eligible beneficiaries will receive their one-time retroactive payment by the end of this month, which is March 2025. This payment will be automatically deposited into the same bank account that the Social Security Administration has on file. And then the regular payment, the first regular payment, which is the new increased payment, the higher amount will arrive in April 2025, representing March 2025 benefit. And then the law only provides retroactive payments back to January 2024. So regardless of how long you've been cheated out of your Social Security benefits due to GPO or WEP, whether it's been 10 years or 20 years, you are only going to get 1 year of retroactive payment starting in January 2024. And as I mentioned, that is about $6,710 on average. So let's look at some case scenarios. If you've been impacted by this, if you're expecting money from this Social Security Fairness Act, how much can you expect? Well, a 71-year-old CSRS retiree who was widowed and previously received $0 in widow benefits due to the GPO will now receive her deceased husband's full benefit of $1,800 a month. She will also, in addition, receive a lump sum payment of approximately $25,000 for 14 months of retroactive benefits. And then an example, a retired federal employee who served in the military will see a WEP reduced benefit of $304 increase to their full benefit of $684, plus all the cost of living adjustments since they began collecting. And then there'll be a retroactive benefit payment of approximately $9,500. Now, if you're a teacher and you've been impacted by this, here's a scenario that could affect you. A retired teacher who receives a state pension and previously had her Social Security benefit reduced to $613 per month will now get their full benefit, and then they'll get a retroactive payment of $8,500 for 14 months. And if you're a first responder, a retired firefighter who has his benefit reduced by $400 monthly will now receive their full Social Security benefit plus a lump sum of $5,600 for 14 months of retroactive benefits. So as you can see, I mean, these are significant amounts that is going to make a huge difference in the over 3.1 million people or 3.2 million people that were impacted by the GPO and the WEP, which the Social Security Fairness Act was intended to repeal. So what should you do? Well, not much. If you're already receiving Social Security benefits and were affected by WEP and GPO, you don't have to take any action. The Social Security Administration will take care of it and send you the payments automatically. If you want to check on the status, you can call them or you can log into your My Social Security account to see what is happening. You probably have to wait a little bit, be patient, because everything is going to kick in at the end of this month all the way through April. So if at the end of April you do not see any action, then you should definitely call the Social Security Administration. But in the meantime, there are people out there that's going to try to scam you out of your money. So be aware that scammers may try to take advantage of this situation by offering help or trying to help you get your increased benefit for a fee. The Social Security Administration will never ask you to pay for assistance to expedite your benefits. So make sure that you're paying attention and don't get scammed of money you've been waiting for a very long time. So I want to hear from you. What do you think about the Social Security Fairness Act? I know this does not apply to everybody, but a lot of people have been waiting for 40 years for this. So I want to hear from you in the comments whether you think this is fair. Should they have passed a law that applies to everybody? Because let's face it, a lot of seniors are hurting right now and they could use some increase in Social Security benefits. So the fact that this law is only affecting a small population, 3 million, a lot of seniors are pushing back and saying they should have done it for everybody. So let me know your thoughts in the comment section below. Now let's talk about Medicaid. So this is big news. A lot of seniors do not realize how much they depend on Medicaid, or Medicaid can impact their lives until it's too late. And now President Trump and the GOP in Congress are getting ready to gut Medicaid. I have all the details. Let's talk about it. But before we do that, we've been talking about Medicare for a while now. A lot of you have been sharing your stories about Medicare Advantage plans or different Medicare plans that you've been in that has not met your need. And so continue to share those stories in the comments. But we have good news. We have partnered with Chapter Medicare. The service is free, and Chapter is one of the only organizations with access to all 24,000 Medicare Advantage plans. They are the only organization with that kind of access. And here is one of the reasons why we partner with them. Their agents do not work for commission. They are there only to help you find the best Medicare plan that suits your need and save you money up to $1,100. So call the number on the screen, 1-800-539-205-2147. Actually, I messed that up. It's 539-205-2147. The service is free and they are there to save you money. But the window closes March 31st. So you have to act now if you want to take advantage of switching to a better Medicare plan. So let's talk about Medicaid. It's been all over the news that Republicans in Congress are getting ready to gut Medicaid. Why should you care? Why is this important and why should seniors care? Well, there's many, many reasons why seniors should care. One of them being that 62% of nursing home stays are paid for by Medicaid. So if Medicaid is gutted, a lot of low-income seniors are going to struggle. And one of the reasons why seniors probably don't think Medicaid affects their lives is because Medicaid is called different things in different states. And since the program is run at the state level, people don't know that their benefits are being cut because it may be called something different in your state. So for example, in Arkansas, it's called healthcare, which is really simple. In Alaska, it's called Denali Care, and in places like New Jersey, it's called the New Jersey Family Care. In Oklahoma, it's called Sooner Care, and in South Carolina, it's called Healthy Connections. So Medicaid may be called different things, and you may be on Medicaid and you may not even know that that is what it's called. So my point is, there's many reasons why seniors need to pay attention to what's happening in Medicaid. So let's get into the details. The first one is that it's going to impact different groups in very devastating ways. Children, 40 to 45% of Medicaid recipients are children. They are going to be impacted. Medicaid is the primary payer of long-term care, covering 62% of nursing home recipients. That is going to be a big deal. Working families, many Medicaid recipients are employed in low-wage jobs that don't offer affordable health care. They are going to be impacted. And here's the big one. Rural hospitals and healthcare facilities rely heavily on Medicaid reimbursement to remain operational. So these cuts are going to force a lot of rural hospitals to close because majority of them depend largely on Medicaid for operational costs. If you are on Medicaid and Medicare and you are dual eligible, there are 12 million of you. Your benefits are also going to be in jeopardy. Why is that important? Well, if you're dual eligible and you're receiving both Medicare and Medicaid, it means that Medicare is being paid for by Medicaid. Your premiums, your deductibles, out-of-pocket costs are all covered by Medicaid. So if you lose your Medicaid coverage, then your Medicare coverage is also in jeopardy. Your monthly premium, Part B, is going to be gone. And then if you have any supplemental dual Medicare Advantage plans, that is also going to be at risk. And this is likely to push a lot of seniors into debt. So why is this happening? Well, they want to find $2 trillion in order to pass the Trump tax cuts, which primarily benefits the super wealthy. And the bill has already passed the House. It is headed to the Senate, and they don't need 60 votes. If you know how these rules work, they're going to use the reconciliation process, the budget reconciliation, which only requires a majority in the Senate. So if they had needed 60 votes, the Democrats would probably have blocked it. But now the Republicans have access to the Senate, the House, the presidency, and they only need a majority in the Senate to pass this reconciliation bill. It is looking like it's going to happen unless a lot of people make noise about it. So this is your opportunity to get ahead of this. Call your senator and let them know that gutting Medicaid is not okay. They want to take $880 billion out of Medicaid, $230 billion out of SNAP, and $330 billion out of education and workforce, all to finance tax cuts that are primarily going to benefit the rich. Now, let me bring it down to individual parts, the 10 different parts that are going to be touched, so that you can see how it affects you or affects somebody you know or somebody you care about. So the first part is those who are on Medicaid and Medicare. If you're dual eligible, you will not be able to pay for your $185 monthly Medicare Part B premium, which is currently covered by Medicaid. And loss of coverage for services Medicare doesn't cover, like long-term care, dental, vision, and hearing services. So your out-of-pocket cost is going to increase and force you to choose between healthcare and other necessities. This is going to impact seniors in very devastating ways. If you know somebody in nursing home or you are yourself, Medicaid covers approximately 62% of all nursing home residents, making the cuts particularly devastating for seniors. And how is this going to impact you? Well, stricter eligibility requirements will force more middle-class families to exhaust their savings. And then families will face the choice between inadequate care and financial ruin. It is also going to affect home health care. Medicaid is the primary payer of home health community-based services that allow seniors to age in place. So if you are trying to stay in your home and you don't want to go to a facility, the wait list is already long for these services. Now it's going to even get longer. So your likelihood of being able to get a home health aide to come and take care of you while you age in place at home is going to be less and less, because now they're going to cut the program and cut the money that is available for this program. Rural hospitals closures will accelerate. Already there are about 600 rural hospitals that are at risk nationally. And as I mentioned before, most rural hospitals depend on Medicaid for funding, because most of their customers or most of their patients are Medicaid recipients. And so if the program is gut, then it means that a lot of seniors and a lot of people in rural areas, veterans, are going to find it very hard to get access to the care that they need. Children are probably going to be the most impacted. Medicaid covers services for about 14 million children. So early intervention services for developmental delayed children will be reduced or eliminated, and families caring for medically complex children will face some devastating financial consequences as a result of this Medicaid cut. Pregnant women, you may not know this, but 1 in 2 births in the United States, 1 in 2 children born in the United States are covered by Medicaid. So rural maternity wards are already closing at alarming rates. This will become even scarier, because then pregnant women are going to find it harder in certain areas to access the pre and post care that they need. Mental health. You may not know this, but Medicaid covers a lot of mental health care. Community mental health services could face funding cuts or closures. Wait time for psychiatric care will increase dramatically, and the ongoing opioid and mental health crisis will worsen, particularly in hard-hit rural. Now, this may seem like doom and gloom, but this is what you need to know, because this is happening right now. And if enough people do not make enough noise about this, it's going to pass, and then your benefits are going to be gone before you realize that they were really going to do it. Because I think a lot of people are in denial that they're not going to gut Medicaid. They're already doing it. It's passed the House. It's moving to the Senate. So my job is to share it with you, and then you do as you will with the information. So another group is people who are working in jobs that does not provide health care. And so they rely on Medicaid to get access to healthcare. They are going to be impacted as well. Veterans, a very important group that are going to be impacted by Medicaid cuts in ways that people don't even realize. Not every veteran qualifies for VA healthcare. So they depend on Medicaid, and there's approximately 1.7 million veterans that rely on Medicaid for health coverage. So with these cuts into Medicaid, those with service-connected issues that don't qualify for VA disability will lose access to care. Veterans in states without VA facilities nearby will face reduced access options. And here's a big one: mental health services crucial for veterans with PTSD will be harder to obtain. And then healthcare workers, people even who work in the healthcare industry, even depend more on Medicaid, because some of them are in jobs that do not provide healthcare, and so they have to depend on Medicaid for themselves, and they are going to also be impacted. So I want to hear from you. I've been doing a lot of these lives, sounding the alarm around Medicaid, because this is such an important program. It is the third biggest budget item on the federal budget and has 82 million people that are directly receiving benefits and are going to be impacted by these changes. So if you are on Medicaid, you know somebody that is, you have a family member, this is your opportunity to share this information with them, share this video with them, and get on the phone and call your representative, your senator, let them know this is not okay, because this is happening as we speak. And if we don't do something to make them realize this is not okay, it is going to pass, and then millions of lives will be affected. So I want to hear from you in the comments below. And until I do another live tomorrow, thank you for hanging with me today.